What can we do to help patients understand or find out if their surgeon is competent to do these procedures? Today, there's not really a lot that we can do. We have board certification, but that is a test of knowledge. When you take the examination, it's an oral exam and it's a written exam, and then you're given a certificate. So if a surgeon says they're board certified, they've passed an examination. And yes, there are some prerequisites that they have to do in order to get there, but it doesn't say that they can do the procedure. So what is the future really hold? I think if we're going to be protecting the public and helping them answer the question, does my surgeon have the goods? Is my surgeon competent to do the procedure that I'm asking him to do? Then I think we need to adopt a standard where the surgeon actually demonstrates competence. Sorry. In order to ensure that the surgeon is actually competent, I think we should adopt standards that are already adopted for the flight industry, meaning the FAA requires that if a pilot is going to fly a plane, he's got to take a test for that plane. Well, if a surgeon is going to do a new procedure, he needs to be trained and tested in that procedure as well. And what practical testing standards means is that we set a high standard for all physicians to achieve. And the standard remains constant for everyone, regardless of whether you are just a brand new medical graduate or if you're a plastic surgeon with 13 years or 15 years of experience, or if you're somebody that has done 100 other procedures and trying to do this procedure kind of brand new. The point is, all procedures are technical, and we have to demonstrate competence in the technique and the skill. When we demonstrate surgical skill, there are really three kinds of surgeons. There are some surgeons that are just naturally gifted, they see it, they can do it. And they will pass the practical testing standards fairly quickly. There are some that can work very hard to get it, and it may take them 10 procedures, and then finally a demonstration of competence to the examiner. And for the last practical testing standard, if they can never get it, we should never give them a certificate that says that they are competent. The FAA does it. I don't see any reason why medicine shouldn't do it. And if pilots are required to meet this standard, I can't understand why physicians are not demanded to meet this standard.